Greetings. Today we embark on an adventurous journey to the enigmatic blue zones. These are regions of our planet, such as Okinawa in Japan, where inhabitants enjoy unusually long and healthy lives. Our focus will be primarily on Okinawa, a place renowned for its longevity secrets. Let's delve into the Okinawan lifestyle and understand what leads to their extended lifespan. Stay with us as we unravel the secrets of living a longer, healthier life, specifically the Okinawan way. These picturesque regions, particularly Okinawa, are not just vacation spots. They are home to some of the oldest people on Earth. Okinawa and places like Ikaria in Greece have been studied extensively for their unique lifestyle habits. The main study carried out by the Okinawa Research Center for Longevity Science, or CLS, the Okinawa Centenarian Study, OCS, is a population-based study of 100-year-olds, centenarians, and other elderly in Okinawa, Japan. Dr. Makoto Suzuki is a clinical cardiologist and geriatrician who has significantly contributed to the longevity study, mainly through his work with the Okinawa Centenarian Study, OCS. He is Professor Emeritus at the University of the Ryukyus. He has held various prestigious positions, including Director of the Okinawa Research Center for Longevity Science and Principal Investigator of the Okinawa Centenarian Study. Dr. Suzuki initiated the Living Centenarian Study in 1976, supported by the Japan Ministry of Health, Labor and Welfare, and has personally examined nearly 1,000 centenarians and thousands of younger elders. His extensive research has resulted in over 300 scientific publications in peer-reviewed journals and more than 700 publications, including books and conference proceedings. Dr. Suzuki's work has been instrumental in establishing Okinawa as a recognized blue zone for its high number of centenarians and exceptional health outcomes. In 1998, Dr. Suzuki was presented with the Nishi Nippon News Award to recognize his lifetime contributions to health and well-being in Japan. Dr. Bradley Wilcox is a professor and director of research at the Department of Geriatric Medicine, John A. Burns School of Medicine, University of Hawaii. He's also the author of the New York Times best-selling book, The Okinawa Program, which explores the link between diet and longevity based on 25 years of research. His work has been featured in prominent media outlets such as Time Magazine and National Geographic and on shows like Oprah and Good Morning America. Dr. Craig Wilcox, the twin brother, is a medical anthropologist and co-author of the Okinawa Program alongside Bradley Wilcox and Makoto Suzuki. He has been involved in the Okinawa Centenarian Study, which has contributed to understanding the cultural and lifestyle factors contributing to Okinawans' exceptional longevity. The Okinawa Centenarian Study, OCS, is a population-based study of centenarians and other elderly individuals in Okinawa, Japan. Established in 1976 by Dr. Makoto Suzuki, the OCS is the longest continuously running study of centenarians worldwide. The study has examined over 1,000 centenarians and thousands of other elderly individuals, focusing on various aspects of health and longevity, including diet, exercise, genetics, and social and behavioral patterns. The OCS has provided valuable insights into the factors that contribute to the exceptional longevity and health of Okinawans, making it a cornerstone of research in the field of gerontology. In cooperation with Dan Buettner, the three broadened the term, applying it to validate longevity areas of Okinawa, Japan, Loma Linda, California, the Nicoya Peninsula, Costa Rica, and Ikaria, Greece. Let's explore these habits, starting with Okinawa. Our focus now is Okinawa's dining table. The dietary intake of Okinawans around 1950 differed significantly from that of other Japanese populations. Okinawans consumed fewer total calories, 1,785 versus 2,068, less polyunsaturated fat, 4.8% of calories versus 8%, and less rice, 144 grams versus 328 grams. They also ate significantly less wheat, barley, and other grains, less sugar, 3 grams versus 8 grams, more legumes, 71 grams versus 55 grams, significantly less fish, 15 grams versus 62 grams, less meat and poultry, 3 grams versus 11 grams, fewer eggs, and less dairy. However, they consume more sweet Okinawan potatoes, 849 grams versus 66 grams, fewer other potatoes, less fruit, and no pickled vegetables. In terms of caloric intake proportions, the traditional Okinawan diet included sweet potatoes, 69%, rice, 12%, other grains, 7%, legumes including soy, 6%, green and yellow vegetables, 3%, refined oils, 2%, fish, 1%, and seaweed, meat, mostly pork, refined sugars, potatoes, eggs, nuts and seeds, dairy and fruit, all less than 1%. This traditional diet was prevalent in Okinawa until the 1960s. Since then, dietary practices have shifted towards Western and mainland Japanese patterns, with fat intake rising from about 6% to 27% of total caloric intake, and sweet potatoes replaced by rice and bread. Seaweed, particularly konbu or kombu, was another low-calorie staple in Okinawa. Rich in protein, amino acids, and minerals such as iodine, seaweed was a standard part of the diet. Wakame, another type of seaweed, was also frequently consumed for its mineral content, including iodine, magnesium, and calcium. Seaweed and tofu were daily dietary components. By 1979, after years of westernization, the annual per capita pork consumption in Okinawa had risen to 7.9 kilograms, 17 pounds, about 50% higher than the Japanese national average. Further, they consume beverages like tea and green tea. Green tea is known for its high antioxidant content, including polyphenols, which protect against disease and aging. The presence of L-theanine in tea aids in stress reduction and mood enhancement. The antioxidant-rich green tea plays a significant role in promoting longevity, which is a characteristic feature of blue zones like Okinawa. Green tea's health benefits, with its antioxidant power, are an essential component of the Okinawan diet, contributing to their exceptional health and longevity. In Okinawa, one of the notable blue zones, physical activity is not seen as a task, but rather an innate part of everyday life. Activities as simple as gardening or walking are not just ordinary, they are the standard, acting as a primary way to keep fit. Daily life in Okinawa is delightfully infused with such straightforward yet highly effective physical engagements. Aside from physical activities, the power of community here truly stands out. In Okinawa, strong social bonds are not just a part of life, they are life. The regularity of social interaction invigorates the mind and acts as a shield against diseases. Okinawa's essence is beautifully characterized by its emphasis on the integration of physical activities and a strong community. Let's compare two culinary practices from diverse parts of the globe, the Okinawa and Mediterranean diets. Focusing on the Okinawa diet stands out with its low-fat and high carbohydrate content, primarily featuring sweet potatoes. Now let's talk about the nutritional benefits. Okinawan purple sweet potatoes are long and tubular, shaped with tan skin and a vibrant purple interior. Also known as Japanese purple potatoes and Hawaiian purple potatoes, they are packed with manganese, vitamins A and C, and a good deal of dietary fiber and iron. They are low in calories. 1 cup contains about 220 calories, similar to 1 cup of brown rice. These vibrant purple sweet potatoes trace their origins back to South America. Historical records reveal an intriguing tale from the 1400s, when Spanish explorers introduced these tubers to the Philippines and China after encountering them in the Aztec Empire. With their captivating hue and distinct flavor, purple sweet potatoes swiftly gained popularity in these new lands, leaving a lasting culinary impact many people enjoy today. They are also a good source of fiber, more fiber than brown rice. 1 cup of purple potato contains about 5 grams of fiber. And why purple? They contain anthocyanins, which are believed to have many health benefits and give it the royal purple coloring. A unique and notable practice from this diet is the hara hachibu principle, which involves eating until one is only 80% full, a tradition that assists in maintaining a lower calorie intake and contributes significantly to longevity. Though both diets are plant-based and rich in fruits and vegetables, the Okinawa diet offers a distinct perspective on eating and health. On the other hand, the Mediterranean diet, with a modest meat intake, is rich in olive oil, fruits, vegetables, and fish, and promotes heart health and longevity, but doesn't spotlight the cultural wisdom of mindful eating as the Okinawa diet does. You don't need to uproot your life to adopt the benefits of the Okinawa Blue Zone lifestyle. This is about embracing their approach to diet, exercise, and community. Try adding some of Okinawa's healthy habits into your daily routine. This could involve incorporating more plant-based foods into your diet or starting your day with gentle exercises like Tai Chi. You could even start a small community garden to foster a sense of community, as is customary in Okinawa. Observe the potential positive influence these changes could have on your health and well-being. Many thanks to Dr. Makoto Suzuki, a prominent figure in longevity studies, particularly among the centenarians of Okinawa, Japan. As the principal author of research on Okinawa's centenarians, Dr. Suzuki has dedicated nearly 40 years to understanding the factors contributing to their exceptional lifespan. Here are some key insights from his work. Dr. Suzuki's research illuminates the secrets behind Okinawa's remarkable longevity, making it a fascinating study area for anyone interested in healthy aging. An ancient inscription engraved on a rock near an Okinawa beach reads, "At 70 you are merely a youth, at 80 you are just a teenager, and at 90 if your ancestors invite you to join them, ask them to wait until you are 100. Then you might consider it." Michel Poulain, Gianni Pes, and Dan Buettner explored various global communities renowned for their high number of centenarians, such as Okinawa in Japan, the Barbagia region of Sardinia, and the Seventh-day Adventist Enclave in California. Michel Poulain, founder of Original Blue Zones Hotspot, called these regions Blue Zones. He and his research team aim to identify common factors among the residents that contribute to a longer, happier, and healthier life. Expected findings included a predominantly plant-based diet, robust social support networks, and moderate physical activity. However, one surprising commonality emerged. Residents continued gardening well into their old age in each community. This is no coincidence, as extensive research supports that gardening enhances well-being and promotes longevity. Why gardening could help you live longer: 1. It gets you into nature. 2. It's good exercise. 3. You'll eat what you grow. 4. It exercises your mind while also relieving stress. So remember, it's about making health a project instead of illness a nightmare. Abraham Moles. Keep with us for the next episode.